Hello, today we are doing Module 5 from Mental Health book. Module 5 is the topic is creating approaches to challenging behaviors. And see the head here, we are creative, we're using our mind to solve the problem for challenging behaviors. Okay, let's go into it. Strategies for approaching behaviors. There is no one size fits all solution when dealing with behaviors. Different people have different needs, so the solution should be it's different. Caregivers' main responsibility while handling challenging behaviors is to remain calm and supportive. To approach behaviors, we have to use three ways. First, stop, and then identify, and then take action. So we're using this step. So you can look here, he can go this way or this way. There is no one solution. Every day, there's a difference. Okay, the first one, let's go look at it. The first one is stop. Stop. When you are faced with unexpected behavior, take a moment to stop yourself and take a step back from the situation and calm yourself and focus. That's what you should do first. There is a reason for the behavior to happen. Challenging behavior is a reaction to something that sets the behavior in motion. Responding to challenging behaviors takes self-control and discipline. The best way to respond is to stop before taking action. So the first action is to stop. Whenever we stop, we have to calm ourselves down. So what are the techniques to calm down? In here, looks the lady is calming down. This one, she looks like she's in a stressful situation. She's trying to stop. That's where she is. Calming techniques. Take a few deep breaths. People have different techniques, or you can count to 10. Separate the behavior from the person. Don't take it personally. Recognize it is not about you. Imagine something that gives you a feeling of calm. Repeat positive phrases to yourself like, I am calm and positive in a difficult situation. Tell it to yourself. If you cannot calm yourself, take some break or ask for help. It's better to walk away for a few minutes and collect yourself than risk reaching and making the situation worse. The second step is identify. You see, you are identifying here. Figure out what's happening. Why is that person acting that way? Identify what caused or triggered the problem. What you see a change that concerns you. Once you identify, you remain emotionally available to the individual, and you will be like genuine to that person, and listen to what the person is communicating through body language, words, emotions, and behind their actions. There are some common triggers that may cause the behavior. They are like physical triggers, environmental triggers, or emotional triggers. The physical triggers can be infection, pain, medication side effect, dehydration, hunger, trust, fatigue, recent injury, incontinence, constipation, uncomfortable clothing, reaction to care being given, or unmet physical needs. Environmental triggers are too much noise or people, temperature too hot or too cold, something new to the environment, lack of privacy, too bright or dark, some smells in the house, full moon or sun setting, shift change. There's a lot of reasons. These are just some of them. Emotional triggers are like change in routine, schedule, recent big changes or losses, difficulty with families or friends, depression, boredom, anxiety, fear, loneliness, lack of intimacy. There's a lot of them. The perspective of the individual you're caring for is what's important when looking for a possible trigger. Other things to look at are what happened just before the behavior start. Where did it occur? What's happening in the person living space? Is this a new behavior? Are there any certain actions that make it worse? You stand up and think in many ways, and you look at different things. Now you identify that the next step is action. You need to take action. The best way to deal with challenging behavior is to adapt as you go to each unique individual and situation. Respectively steer the individual away from what triggers the behavior. Willing to do something different if what you tried does not seem to be working is another one too. So tips for approaching: whenever you go to client room, knock on the door, ask permission to enter personal space, smile genuinely, try to get the person attention before you talk, move slowly, avoid sudden movements, identify yourself and why you are there, and things like that. So action is the last step. So when we are on action, there are a lot of things to learn. As much as possible, we need to eliminate the trigger. If we know the triggers, minimize it as much as possible. Big one to the small one, as much as possible, minimize it. We can't stop it, but we can minimize it. If we can eliminate it. That's good. Adapt to the individual in their routines. Be aware and observant of subtle details. Example, what kind of things or situations makes the individual angry? What pace of activity is comfortable for the individual? Is there anything unique to the individual culture? And give space is another one. Usually, we have to give 5 to 10 minutes to the individual to calm him or her down. We need to give a space, a little bit. We need to give them space, and then when we come back, they will get better. This one is adapt. Reassure. Reassure is listen. Let the individual talk about their feeling. Be understanding and sympathetic. Maintain clear boundaries if you are treated with disrespect. Soothe and comfort. Slow down your own movement and energy. Try not to show any anxiety or other intense emotions. Validate the person's feeling. Speak slowly, softly, with a low pitch in a reassuring tone. Offer things you know that can comfort the individual. Example, you can give a cup of tea or a favorite show or reduce distraction or loud background noises as much as possible. Play relaxation or anti-anxiety music or medications. Or another way is we can distract or redirect. Offer choices like favorite activity like walking, snacks or beverages, change the conversation to something positive, encourage the person to take several deep breaths or reinforce positive behavior, and this one is music. You can do whatever that's possible out there. And encourage, listen, use praise, reinforce positive behaviors. Happy reminders like family pictures, engage in health behaviors in a diet, exercise, and socializing with other people. Encourage them. If they are low, encourage them, hold them. Protect and support other beings impacted by the behavior. If you need help, you need to get it. Then self-care is other important part. You need to replenish your emotional reserve after handling stressful behaviors. This requires self-care. So take time to manage your feeling. Document in the report. It's good to share what you experienced, what actions you took, and what did and did not work. Writing down what happened and what actions you took give for your coworkers a record, and a good it's a point way to start for other people. Now we finished the stop, identify, and action. Now let's talk about it, how we help some people. Just a summarization from the other topics. Or if you have a mental health client with a mental health disorder with hallucination, when this people seems to be when you hear voices or see things you do not see, stay calm. Try to distract by asking the person to do something or by engaging in conversation. If the person is hearing voices more and more, maybe a sign of relapse. Encourage the individual to speak with a health professional. Do not pretend to see or hear what the person hears, but acknowledge what they are hearing. I believe you hear another voice, even though I do not. Like that. Okay. With a person with a depression, gently encourage engagement in activities. Allow the individual to set the pace. Respect the individual emotional and physical limitations. May need rest to get well again. Getting outside and doing physical activity of any form give a sense of accomplishment and boost self-confidence. Be sure to give positive feedback for all accomplishments. Delusion. A delusion is a fixed false idea, sometimes based on a misinterpretation of a situation. It's pointless to argue with this kind of people. Acknowledge that you appreciate that the person truly believes what they are saying, but do not agree with it. It's better to help with the distressing emotions the person is feeling rather than to dismiss the belief. Manic behavior. Manic behavior patterns include hyperactivity, heightened mood to the point of elation and overexcitement. If an individual has manic behavior, try to be calming influence. Try to slow things down. Talk more slowly. Walk more slowly. Express your concerns about the actions, but be prepared that the individual may not see anything wrong. Set clear limits on behavior and take actions when warning signs begin to appear. Social withdrawal. Withdrawal from family, friends, and activities. That's what a social withdrawal means. Gently encourage the individual to participate in everyday activities like eating meals, watching television, and more, and be prepared for the individual to refuse. It may be difficult for him, for the client, depending on the stage of recovery. Large gathering or busy group activities may be too overwhelming for this kind of people. Aggressive behaviors. You do not have to tolerate violent or aggressive behaviors. The first thing to do is to assess the level of danger. If you feel safety is at immediate risk, call 911 for help. If you feel the situation is safe, try to find out why the individual is angry. The most effective way to calm a person is to encourage them to talk about their anger. Acknowledge feeling with comments such as, I can see you are angry, or I appreciate how you feel. Try not to argue, it could make the situation worse. Apathy or lack of motivation. For this kind of mental disorder people, ask the individual to help with simple tasks or chores, and be sure to say thank you for this person. You may say something like, thank you for helping me with the laundry. I enjoyed your company. It makes the chores much easier. Regular exercise and mental activity, like going for a walk or redirecting the newspaper, can also help. It's important to move at a manageable pace. Pushing to do too much too soon can be overwhelming and maybe stress to the client life. Substance use. Mental disorders and abuse substances are frequently occur together. 50% of people living with mental health conditions also experience a substance use problem. People with a mental disorder are more sensitive to the effect of a substance. Substances interfere with the effectiveness of prescribed medication. They can also increase symptoms and risk of relapse. Use of substances use are linked to increase the risk of violence. People who have mental disorders and serious problems with substances use are said to have concurrent disorder. Now we're going to lesson 9, crisis management. Look, the guy's here and it's falling both sides, but he's trying to stop it. So when we have a crisis, we're trying to stop the crisis or we're trying to manage it. The lady looks like she's in crisis. I think the picture is cut off. She was talking on the phone. She's seems like she's crying too. She's on a crisis, that's what I believed. What's a crisis? Crisis is a non-life-threatening situation in which an individual is exhibiting extreme emotional disturbance or behaviors. Those consider harm to self or others. This person may consider harm to self or others, or disoriented or out of touch with reality, and has a compromised ability to function or otherwise, agitated and unable to be calmed. This is what the crisis means. A non-life-threatening situation. It's not life-threatening, it's a non-life-threatening situation in which an individual is exhibiting extreme emotional disturbance or behavioral distress that considered harm to self or others, or disoriented or out of touch with reality, has a compromised ability to function or otherwise, agitated and unable to be calmed. Example, talking about suicide threats or threatening behavior or self-injury, alcohol or substance abuse, or unstable behavior, eating disorder, not taking psychiatric medications, all of this can be a crisis at times. Adverting crisis. As you can see, the dominoes are like straight over here, but they are trying to fall in here. And if this guy doesn't put his hand in there, they continue to destroy all the other ones. So this hand is averting the dominoes. That's what it is. It's stopping it. There are things you can do before a situation become a crisis. First, watch for early signs. It can be change in sleep or social activity or suspicious or worsening anxiety or mood swing. Watch for early signs. Second, try to find out what's going on. And third, try to get the person to see a psychiatrist or social worker or case manager if they have one. Critical factors about the crisis. Critical risk factors. Has the person made a direct threat or been violent recently? You ask yourself. Has the person made any destructive or threatening statements? Has the person intentionally frightened someone? Has the person been stalking or following people? Is the person preoccupied or dwelling on injuries or unrealistic fear? Does the person have a history of anger problem bordering on violent behavior? Has the person been increasingly angry, aggressive, or violent over time? Has the person made statements or implied they might have a plan? Has the person made a statement or implied they might have a plan? Has the person made a statement or implied they might have a weapon? If you answer one of these questions, that means there is a risk for crisis in there. When there is no immediate danger, so if you know there is a risk for that person is a risk for crisis, so you need to come up with a plan when there is no immediate danger. Identify the risk factors. You're not in crisis right now, so you sit down and you plan. Identify the risk factors and discuss this with people who can be supportive and offer constructive advice. And report and document any information regarding violent or threatening behavior. And prevent violence by paying attention to warning signs, seeking advice from qualified mental health professionals and supervisors. And then document. Oh, of course, you have to document. And the next one we're looking at is decompensation. Decompensation is when symptoms of mental health disorder began to be more prominent and the person is unable to manage or cope with his or her symptom. It's a downward slide from person baseline. The baseline is here. It's a downward slide that leads to decline in the person's ability to think and carry on with daily activities. Decompensation. The, the, there may be a lot of causes like stress, change in person's daily activity, fatigue, illness, maybe not taking prescribed medication. What can be done? So we know the causes. It's not a lot of them to mention. Talk to the person what he or she is feeling. Involve the person in activity. Help the person to stay focused. Being consistent and non-judgmental. Call assistance when needed. There are symptoms of decompensation. Without intervention, decompensation can lead to relapse. Relapse is a more serious step. Symptoms of decomposition are unique to each person. It's important to find out what symptoms of individual has experienced in the past so that you can watch for them. Symptoms like sensory changes, it can be taste, smell, hear, or see. Perceptual changes, maybe person misinterpret what's going on around him or her. Most frequent hallucinations and delusions. More paranoia or emotional changes like feeling are more extreme, maybe. Change in speech, maybe the sound can be different or difficult to understand. Or it can be change in socialization, maybe withdrawn or stop talking people. Or it can be cognitive changes like difficulty thinking, or maybe the person seems confused. When the client is doing well, talk to him or her about the techniques that have worked in the past so you can be prepared to use them when needed. Relapse. Relapse is when the symptom of illness worsen or when previous symptom return and severe enough to require professional intervention. That's relapse. That person has to go hospital. It's serious enough. To the cause of the relapse, there's no apparent cause. The symptoms come and go in cycle. Even with best treatment and support, sometimes it can still happen. To prevent a relapse, we can have a mental health manager or other mental health professional for support, or we can involve family members to plan using a positive self-suggestions to overpower or unwanted thoughts, doing an activity the person enjoys that can help, or walking, getting adequate rest and sleep can help relapse. So relapse plan or crisis plan. Relapse plan is pre-arranged plan for what to do when a person experiences a relapse. It includes events or situations that have triggered a relapse in the past, early warning signs the person experienced in the past, what has helped the person in the past when the person experienced those early warning signs, who the person wanted contacted, what each person role in the plan. So it's very important to do the relapse plan. Okay, when a crisis occurs, what do we do? If you feel there's danger to any person, either call the crisis center for help in assessing seriousness of the situation, 988, or seek assistance from a local enforcement officer, call 911. Have the person medical information on hand. Written information about the person's diagnosis, medication, and specific events or behaviors that cause you concern are very important. Crisis de-escalation. This de-escalation is a method to prevent potential violence. Individuals are encouraged to use purposeful actions, verbal communication, and body language to calm a potentially dangerous situation. De-escalation is like the action you take to reduce the intensity or conflict crisis of a potentially violent situation. We can use stop, identify, and action method for de-escalation too. Examples are like give the person your attention all the time when you are doing that. Be non-judgmental, focus on feeling. Like that must be very scary for you. Allow silence, clarify messages, develop a plan, use team approach, use positive self-talk, recognize personal limit, and debrief. De-escalation. If somebody is very hot and very angry and it goes down, getting better, it becomes to the green. That's de-escalation. Mood changes are changes in the environment in which something occurs or develops, like aggression and agitation. Agitation is a state of anxiety or nervous excitement. It comes before aggression. Agitation is like when the pace, yelling, making verbal threats, and things like that. Aggression is hostile or violent behavior or attitude toward others. They're like verbal warning signs for violence, and there's non-verbal warning signs. The verbal ones are like verbal, they talk, they speak. Threats or boost of prior violence, confused thinking, bargaining about losing control, increased speech when speaking, repetitive word use, parrot, echo, forced or strained speech, nervous laugh, yelling or screaming, non-stop profanity, slurred speech, talk. These are the verbal ones. The non-verbal ones are like the personal space violations, like standing toe-to-toe, finger pointing, making fists, face flashing, heavy breathing, flaring nostrils, person refuse any eye contact, or someone block doorway, like that. These are the non-verbal warning signs of violence. Non-confrontational languages are very useful words. Early agitation often resolve with supportive non-confrontational languages. Use a person name. Ask, may I help you? Speak slowly. Use restatement for clarification. Ask to take notes. Paraphrase. What and we. Allow time for reflection. Give options. Ask for their ideas or solution. Use simple words. Maintain appropriate eye contact. Avoid languages or actions that are bad, like we're not supposed to fake attention, or rolling your eyes, making false promises, using jargons, agreeing with someone or taking sides, cutting people off, getting in a power struggle, raising your voice, losing your temper, meeting one-on-one with an angry person, allowing more than one person to talk, or arguing, saying, calm down, things like that. These are words that we need to avoid. Situational awareness is being aware of what's happening around you in terms of where you are, where you're supposed to be, and whether anyone or anything around you is a threat to your health and safety. There are different level of awareness. White is when you are on white, someone unaware, unprepared, unconcerned. Normal state of mind when we are in the safety of our home. And yellow is someone who is alert, attentive, and calm. Normal state when we are out and about. And orange is someone who has heightened awareness directed at potential threat. Something is wrong, start. So this time you need to start planning. The focus stays on the threat to either advance or to red or move back to yellow. So red is the last one, aware that a threat or danger exists and immediate action is needed. Debriefing is an activity where you evaluate and discuss what happened during the event. There are 6 techniques in debriefing. The first one is control. Regain physical and emotional control of yourself and stop, pause, and calm yourself in this step. Are you ready to discuss what happened, what went well, and what can be done differently in the future? And second step is orient. What are the basic facts of the incident? Be non-judgmental and listen to the perspective of every person who was involved. What happened? Who was involved? When did they get there? What was each person's response during the situation? And the third one is pattern. Look for patterns in cause and responses. What trends did each person observe? Are there things that seem to have caused the behavior? Do staff have precipitating factors at play as well? If so, what are they? The fourth one is like investigator. We need to look at it, brainstorm options of what might be done differently next time, what things you can do to prevent a situation from occurring, how can you strengthen or improve individual and team responses, what resources do you have available, what skills can team members practice. The fifth one is negotiate, agree on what changes and improvement to make a commitment to change, agree on how to respond in the future. And the last one is give, offer support and encouragement, and express trust, confidence, and respect for your colleagues. And the last one is crisis resources. If you need to call a mental health professional or the crisis team, remember to stay calm and then give clear, objective example of how the person behavior or or a train of thoughts is seriously impacting his or her own safety or that others. You have to give clear and objective example. And then give the person a diagnosis, a brief history of the build up to the crisis situation. Make sure to get a total picture of the person's mental health relapse. If the person has been hospitalized before and appears to need that level of care again, be certain to share that information. Thank you very much, and we are done with our today's topic. These are the resources.